If you missed yesterday's monthly webinar with Dr. Lisa, you missed the most asked question. What should people with lipedema and MCAS be eating? Everywhere we turn, someone is telling us to remove something like gluten, avoid rice, stop eating beans, fear carbohydrates, eliminate dairy, or follow one rigid plan forever. Before long, we are left with these tiny lists of safe foods, anxiety around eating, and a nutritional plan that is nearly impossible to sustain. At Lipedema Warrior Clinic, we do not believe there is one universal lipedema or MCAS diet. We do not all have the same genetics, metabolic health, hormone patterns, gut function, inflammatory triggers, medical conditions, medications, lifestyle, or food preferences. Nutrition should be personalized, nutritional adequate, and realistic enough to support somebody for the long term. There may be valid reasons to remove or limit certain foods. Someone may have celiac disease, a diagnosed allergy, a specific food sensitivity, impaired glucose regulation, or some other clinical reason. But to temporarily target nutrition therapy is very different from announcing that every woman with lipedema or MCAS or both must permanently avoid an entire food group. Gluten-containing whole grains, brown rice, quinoa, beans, lentil, oats, fruits, vegetables, nuts, and seeds may provide valuable fiber and nutrients for many people. They may support satiety, bowel health, microbiome diversity, metabolic health, and long-term nutritional balance. They may not be appropriate for every person in every stage of care, but they should not be automatically be treated like the enemy. The goal should not be to place us in a food jail. The goal should be to help us build the widest, most nourishing, and sustainable diet our individual bodies can tolerate. This conversation also needs an important caveat. Credentials and professional scope matter in every direction. The term nutritionalist is not legally protected in many places, which means it does not necessarily tell you what education, clinical training, or licensing somebody has. Health coaches can provide valuable education, encouragement, accountability, meal planning, and support, but they should not diagnose medical conditions or independently interpret complex medical testing outside of their training and legal scope. That same caution should apply when anyone begins ordering or interpreting blood work, hormone panels, metabolic testing, gut testing, or other medical diagnostics. These tests are not simply wellness questionnaires with numbers attached. Results must be interpreted within the person's symptoms, medical history, medication, diagnoses, examination findings, and the limitations of the test itself, because the testing available to non-medical professionals are not complete. Medical testing should be ordered, reviewed, and clinically managed by an appropriately licensed medical professional with referrals to registered dietitians or other qualified clinicians when their expertise is needed. The nutritional credential does not automatically make someone qualified to practice medicine, just as being a physician does not automatically make someone a specialist in every area of nutrition. Good care is built through teamwork. At our clinic, Dr. Lisa brings the medical pieces together while health coaching helps patients translate that individualized medical plan into practical, sustainable daily habits. We believe patients deserve both evidence and empathy without fear-based food rules, professional overreach, or one size fits all. Eat real, nourishing food whenever possible. Eat outside of the box, not from a box. Personalize wherever necessary. Thoughtful testing through a medical professional. Reintroduce foods when clinically appropriate. And always ask whether the person advising you is practicing within their boundaries of their actual education, license, and expertise. Those of us with lipedema and MCAS have already spent far too long being blamed, dismissed, and confused. We deserve better than another rigid diet. Be mindful who you are following and taking advice from.